Hello, 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 and welcome everyone to our afternoon webinar presentation entitled The Merits of Including Coping and Self-Efficacy Strategies and Bundled Interventions to Improve Care, Treatment, Outcomes, and Health Equity for Black Women Living with HIV. My name is Dr. Tashina Reeder, and I am the Director of the Community Health Training Alliance, and I'm excited that you've decided to hang out with us this afternoon. Again, after an amazing webinar this morning we had at 11 a.m. I thank you for joining us for our second webinar for our week 2 webinar series for our HIV prevention and education summit with the theme this year, It Takes a Village, Building Community and Health Advocacy. But before we get into today's presentation, there are a few things that I would like to remind you of. One, the chat box has been disabled. Therefore, you can ask all of your questions, your thoughts, your comments. We want to hear from you. You could put that in the Q&A box below. At the end of the presentation, your questions will be answered at the end. And so without further ado, I'm going to turn over the presentation to Alexandra.
Hi, thank you so much, Dr. Reeder. So hi, everyone. I hope everyone can hear me. Again, my name is Alexandra Dongala. I am a Maryland native who's passionate about educating others regarding their sexual health and wellness, bodily autonomy, and reproductive rights. I attended Emory University, where I obtained my MPH in public health with an emphasis on behavioral sciences and health education. In my career has focused mainly on education, community engagement, youth development, reproductive justice, and health promotion in schools, health facilities, and community-based settings. As of now, I am the SHE coordinator, as well as the women's health coordinator at the City of Philadelphia, or Department of Public Health. Sorry if I cough a little bit, my throat is a bit dry. So I am going to move forward with the presentation. So give me 1 second. Okay, I'm going to share my screen.
Okay, I don't feel bad. I didn't do the singing.
If the other speakers could mute themselves, that would be great. Okay. So this is our presentation, The Merits of Including Coping and Self-Efficacy Strategies in Bundled Interventions to Improve Care, Treatment, Outcomes, and Health Equity for Black Women Living with HIV. So we'll start. The Black Women's First initiative aims to inform and advance HIV care and treatment by employing culturally responsive and evidence-based bundled interventions to quickly respond to the needs of Black women living with HIV. The Black Women First initiative is funded by the Health Resources and Services Administration, or HRSA, under the auspices of the administration's special projects of national significance, or SPINS. So despite 30 years of research, Black women are still disproportionately affected by HIV. The Black Women First initiative aims to inform and advance HIV care and treatment by employing culturally responsive and evidence-based bundled intervention to quickly respond to the emergency needs of Black women living with HIV. So it is a multi-site project consisting of 12 demonstrative sites at various locations within the United States and the City of Philadelphia site. is in collaboration with the Philadelphia Black Women Alliance, who you will hear about next. Sorry. So just to give you a quick overview of our organization, of course, our mission is to live healthy. And we are part of the Ambulatory Health Services, or AHS, which is essentially a network of eight neighborhood-based health centers, which offers a full range of medical and support services. We're currently serving a total of 1,000 patients living with HIV. And it's broken down in race, gender, and age, as you'll see. Predominantly, our patients or population are Black, 84%, followed by white, 8.3, Hispanic, and Asian and Pacific Islander last. Most of our patients are male, at almost 63%, female, 33%, and transgender, male to female, last at 1%. And age-wise, we primarily serve folks between the range of 45 to 64, followed by 25 to 44 at 28%, and then 65 plus at 12%, and ages 13 to 24 last. And 72% of our patients are below the poverty, the federal poverty level. So I want to talk about our bundled intervention, which is essentially called Sisterhood for Health Equity. I blanked out, I don't know why. And to be part of the SHE program, essentially our criteria are as does. You have to be cisgender or transgender female. You have to be a woman who self-identifies as Black, newly diagnosed HIV, super utilizer of healthcare services, and that's defined as 2 ED visits, 1 hospitalization within 12 months, medical and social needs causing struggle to adhere to the HIV care continuum, 2 missed scheduled HIV primary care appointments within 12 months, and those who are out of care or lost to care. So these are our goals of the SHE program, which essentially is improve health outcomes for Black women living with HIV, remove barriers and stigma, build trust through trauma-informed care, provide health and wellness education, enable access to digital tools for patient connection, and reach Black, cisgender, and transgender women of Hispanic or non-Hispanic ethnicity. So our bundled intervention falls under 3 arms: the red carpet care, trauma-informed care, and the primetime sister circle. So I would add that initially the SHE program, our intervention was planned to be done in the home. But in lieu of that, it is being done at the health centers and virtually. And each woman who entered the SHE program received a SHE welcome bag. A SHE welcome bag, which essentially has a lot of like goodies, like scales, blood pressure, machine, and so forth. Okay, so the red carpet care is essentially designed to intensify clinical and social support temporarily for supervisor of healthcare services. And it is led by our nurse practitioner and clinical social worker team. Then we have a trauma-informed care, which essentially is sort of the theory that we're using to provide the services to the women who are part of the SHE program. We've had it's an ongoing staff training, but also we're using trauma-informed center-based champions, which are essentially nurses at different health centers who are essential identifying women who will be best to be part of the SHE program. And then we have the Primetime Sister Circle, which is provided by the Philadelphia Black Women Health Alliance, the speakers after me. But essentially, it's a 12-week wellness program intended to reduce health disparities and improve outcomes. So in a bigger form, this is pretty much what I've said before, that the red carpet care is led by a nurse practitioner and a licensed clinical social worker who also conduct behavioral health counseling. There's a full baseline assessment of each participant in her biopsychosocial environment that inform a care plan, which is essentially determined by the full care team, including medical case manager. And like I said before, the red carpet care intervention are built on principles of trauma-informed care. And then we have the Primetime Sister Circle. Again, intervention in a sort of a 12-week period, 2 hours per week program. It is a facilitator expert directed wellness program targeting Black women, primarily 14 to 75 years old, and led by the Gaston and Porter Health Improvement Center. And you'll get the amazing chance to hear Dr. Porter talk more about that. Essentially, the curriculum touches on the following subject: prevention habits, stress management, hypertension, nutrition, physical activity, self-esteem, and positive lifestyle change, among others. So I would say the benefit of participating in the Primetime Sister Circle is, again, you gain a strong sense of self-efficacy, as well as adopting healthy coping mechanism. And according to Albert Bandura, who is the person who coined the term self-efficacy, self-efficacy is the belief in one's capabilities to organize and execute the courses of action required to manage prospective situation. And essentially, self-efficacy is a person's belief and his or her ability to succeed in a particular situation. And the most effective way of developing a strong sense of efficacy is through a mastery experiences. So performing a task successfully strengthens our sense of self-efficacy, which is asked of the women who participate in the Primetime Sister Circle, right? So making sure that they take ownership of their nutrition, take ownership of their health or physical activity. So that's pretty much what is being asked of women who are part of the Primetime Sister Circle. So the benefits, of course, is develop deeper interest in the activity in which women in which they participate. You form a stronger sense of commitment to their interests and activities, and you can recover quickly from setbacks and disappointment. But also you view challenging problems as tasks to be mastered, right? So if you're faced with a large issue, think of it as a pie. And hopefully being part of the Primetime Sister Circle and gaining some self-efficacy is being able to cut that pie into like small little portions and tackle it. So healthy coping mechanism, relying on one's village. And that can also be people you're related to, but also the women who are part of the Primetime Sister Circle, right? So looking at social support from one's children, grandchildren, other family members, friends, peer, caring providers. A lot of the women are being followed by our nurse practitioner. So having her as someone in a corner is also an asset to having a healthy coping mechanism when faced with stress and challenges. Higher social support. We know the higher social support is related to higher mental health quality of life among Black women living with HIV. But also a healthy coping mechanism is, eating healthy, exercising, but also recognizing when you need more help, which is great when you're part of a group of women who share the same experience. All right. Let's see. Did I? Yeah. Okay. So talking about the trauma-informed care. So the trauma-informed care intervention and operation is, for basic principle, realizing the prevalence of traumatic events and the widespread impact of trauma, recognize the signs and symptoms of trauma, respond by integrating knowledge about trauma into policies, procedures, and practices. And 4, seek to actively resist re-traumatization. And it's just pretty much just saying that when dealing with Black women living with HIV, you are aware of the trauma that they may have experienced, and that guide your interaction with them. We have a secure buy-in. Our partner, Primetime Sister Circle, has Black Women Health Alliance has done focus group with the potential members of the Primetime Sister Circle to determine the best way to meet program participants' need. And in terms of adaptation, it's already mentioned that the red carpet care has been modified to an in-clinic walk-in model to accommodate the needs of participants. In-home care is not really advised at this time due to COVID and increasing cases of COVID. We have the trauma-informed champions, who are priority nurses who sort of champions this program and ensure that priority patients, and by priority patients, I feel like that's a term that we internally use, but priority nurses or priority patients pretty much just refer to patients who are living with HIV. But the champions make sure that they are getting the care and support that they need and deserve. And we currently have 5 nurses. The perfect plan is to have 2 priority nurses per health centers, but yeah, we're still working on that. So the referral and project process is as such. We will essentially conduct and inform once we've identified a person who matched the criteria to be part of SHE. We will conduct an informed consent, meet with the women, and the women are seen within 7 days by the nurse practitioner. And then there's a weekly touch base calls and visit for patients, and monthly thereafter. And then we have 5, this enhanced coordination of care for 6 months, right? Where we make sure that they come in regularly to get seen, to get their labs done, and we take care of any issues they may be dealing with. And some of the women may opt to be part of the Primetime Sister Circle. So this is just a quick snapshot of the intervention that have been provided to the women who are currently part of the SHE program. As you'll say, we are currently serving 32 patients, and 32 of them have received red carpet care, 13 self-efficacy, specifically trauma-informed care, and 23 just other type of intervention. Okay. So let's talk about some of our challenges that we faced. Again, red carpet care was originally meant to be implemented at the patient's home, eliminating transportation issues, which affect retention rates, right? If they can't come to the health centers to be seen and so forth. And the Primetime Sister Circle was originally written to be implemented in person. Due to COVID-19, these interventions have been placed in clinic and online. And we've also dealt with a lot of staffing changes, but also working on other extraneous life stresses causing women to drop out of the SHE program. They just have other priorities, and that's okay. And some other challenges has been getting we have patients who fit this program to actually having a list of saved patients. So talking to, a nurse that may not necessarily be part of the SHE program, it may not be one of our champions, but hearing about our criteria and be like, oh yeah, I know a couple of patients, but then actually having that list in our hand has been a bit of a challenge. And also, but also that said, that the sad reality as well as participant on readiness is their need for privacy, and the fact that several participants were not familiar with using tablets collectively resulted in less participant than we had hoped for. So our target number is 60 participants, at least by the end of August, early September, and we're currently at 32. So hopefully we can get those numbers up by then. Successes. So the good part of this presentation is that we've implemented it, the project. It's done. We have provided counseling and provided coping skills to patients, and women who were out of antiretroviral medicine due to COVID. We're linked back to their medication and it's back to undetected status. We've strengthened community partnership for Primetime Sister Circle, by creating a new partnership with T-Mobile. So as part of the Primetime Sister Circle, women receive a tablet, and that tablet is provided to us through our partnership with T-Mobile. We also are granted a trauma-informed care training for all AHS staff in October 2021. We graduated 6 women from the Primetime Sister Circle out of 13, I believe. And women in a Primetime Sister Circle indicated that they felt comfort and safety in the opportunity to share with other women in formed relationships. And several members reported improved mental health, exercise regularly, weight loss, healthier eating habits, and better blood pressure. Some women felt comfortable enough to share the struggles associated with the status. And I want to highlight that because although the group is specifically for women living with HIV is not the focus of the Primetime Sister Circle. The focus is on preventative health, physical and mental health and well-being. Women love the Primetime Sister Circle so much that the Black Women Health Alliance added a 2 group session, which included a movie night and a group check-in session. And I'm sure they'll mention that in their own presentation. Okay, so that's our team. We have Dr. Kwakwa, who is our principal investigator, but she also is our medical care clinical director. Here's our contact information as well. Excuse me. And then there's me, she coordinator. Pretty much my job has been data validation, and flow management. And then we have Dr. Judith Jolie Mears-Levy, who has been very, very, very much helpful in this project. And I think you'll see that every one of us wear multiple hats, including Dr. Mears. And sometimes I wonder if she has time to sleep, but she does everything related to evaluation and grant reports, and also helping with our upcoming implementation manual that will be available for everyone. And then we have Tawana Stokes, who is our nurse practitioner. She's our family nurse practitioner. And then we have Natasha McCoy, who is our She client interviewer, but also works as our patient support coordinator. And so if you have any patients or women who will be great for the She program, Natasha is the person, go-to person to reach out to. And then we have Mondi Dorsendale, who is our clinical social worker. Our medical case manager. So he also wears many hats. Let's see. And then we have Gina Slocum, who is kind of our administrative person, who has been very important in making sure that we order those tablets, order anything behind the scene that makes the She program works. And then finally, we have Alexa Primavera, who is our She MD and MPH student intern for the She program. And that is it for me. And I will pass on the torch to Ms. Brenda for their presentation. Thank you.
Good afternoon, everyone. We are so excited to be here. And I am the Executive Director of the Black Women's Health Alliance. And we have a lot of information to share with you. Our organization has been around since 1983. Started as the Philadelphia Black Women's Health Project, and is now approximately, 7 to 10 years ago, we became the Philadelphia Black Women's Health Alliance. And as a part previously of the National Black Women's Health Project organization, which is now the Black Women's Health Imperative. Okay. Our mission: to improve the healthcare outcomes and reduce health disparities experienced by Black women and other women of color, their families, through advocacy, education, research, and support activities, programs, and services. I talked about 1983 when we started in a meeting, national meeting held in Atlanta, Georgia. 100 women got on board buses here in Philadelphia and traveled to Atlanta to the conference. And because the voices of women, they felt that the voices of women were not being heard in the community. What we have pulled and integrated into our operation and organization is listening, responding to the voices, analyzing data and research and guide our work. 2010, we expanded to include mental health and holistic health. And 2011, launched the Creating a Legacy of Wellness, Mind, Body, and Spirit program. Our target, once again, health disparities. When you look at each of these issues, yes, there are health disparate conditions, which made us so vulnerable to COVID. Many of you, I'm preaching to the choir. I'm not necessarily going to read the list. You know the list. But what the Primetime Sister Circle program does, and this partnership with the Philadelphia Department of Philadelphia Department of Public Health, it focuses on us. We are always ready to move, to partner, to do the work. In 2011, we partnered with co-developers of the Primetime Sister Circle program, Doctors Marilyn Gaston and Gail Porter of the Gaston and Porter Health Improvement Center, Inc. We were one of 8 sites, and I think Dr. Porter is going to touch on this, one of 8 sites nationally as a result of a Walmart grant, but that have participated. It is one of the most significant programs that I have had the experience to be involved with, impacting and improving health outcomes of Black women. It's evidence-based, it's socially innovative, and it's designed to focus on us, zeroing in on the women 40 to 75 years of age in the areas of, stress management, nutrition, fitness, and prioritizing their own health. More than 325 women, I'm happy to say, have participated in the Black Women's Health Alliance PTSD program. And this has occurred as a result of the partnership and ongoing partnership with the Gaston and Porter Health Improvement Center. Let's talk about this synergy that exists between our organization and the health department and this SHE program. When I was contacted to explore the possibility of partnering and found out about more and more about the SHE program, I was very excited. That occurred in September of 2020. When you look at the mission, the vision, the services, the programs, there's synergy there. What did we do? Our key partner on Primetime Sister Circle, as usual, especially with us, the target population, we were modifying it a little bit. So we reached out, and we happy to say yes. Dr. Gaston and Porter agreed to partner with us on their curriculum. And so what is it that the functions that they've been performing? As usual, focus group, listening to the voices, hearing. What did they do? Develop curriculum adaptations and modifications based on the voices, based on what the women said their needs were, comparing it to the curriculum structure, then this was the biggie. As a result of COVID, we had to bend. We had to transition from conducting face-to-face workshops to conducting virtual workshops because it was a pandemic, and developing e-learning curriculum that had to occur. As well, Dr. Dyson and Porter provide technical assistance and support, as well as the evaluation for the project. I'm going to toss this presentation to Barbara Washington, Barbara Washington is the facilitator. Barbara is trained, certified by the Gaston and Porter Health and Improvement Center as a facilitator. She has her master's in public health, and we are happy to have her on board. She's going to talk and share with you how the program has been implemented with the SHE program. Barbara?
Okay, good afternoon, and thank you so much for giving me this opportunity to talk a little bit about the implementation. And I just want to throw one caveat in there is that I was also a Primetime Sister Circle participant 10 years ago, at least. But, and now I'm a facilitator and happy to do it. So after this wonderful relationship was established with the Philadelphia Health Department, Black Women's Health Alliance, the SHE program, and Gaston and Porter, we came together and had bi-weekly planning meetings. And these meetings were held actually several months before we actually did our first project with the SHE program. And so these meetings consisted of just developing plans, how we're going to roll this out, how we're going to make this work. And also, as mentioned, we had to make a decision as to whether this program was going to be virtual or face-to-face, because this, as we were rolling it out or planning for it, COVID was pretty rapid at that time. I'm not even sure if we really were doing the shots at that time. So it was, so anyway, it turned out that the program would be virtual as opposed to face-to-face, at least at that time. Marketing. So the Philadelphia Health Department developed a beautiful flyer encouraging the women to participate. I know that the social workers that I was working with at the time were meeting with the participants, calling them on the phone, inviting them to participate in the program. Referrals were even made from their PCP. I know several of the ladies that I've interviewed with the first and as we're planning for the second cohort told me that they were referred by Dr. Kwakwa and or some of their PCPs and encouraged them to participate and that this program would be beneficial. So we kind of pulled out all the stops in getting the women encouraged to participate. And as a result, had 15 women that were actively enrolled. And we'll talk about how that number changed. Data sharing. This is a research project. And so therefore it was very important to have an understanding of how the data sharing was going to happen and evaluations. Distribution of materials, as previously mentioned by Alexandra. So the participants were given several incentives to participate in the program, which included, as we said, the scales and blood pressure cuffs, tape measure, all those things, tools to just kind of help them to take more control of their health. And during the process of the 12 weeks, women were also given, and these were things that we discussed that would that we want to plan to give to the ladies so that we could have an effective program. Tablets were major since it was going to be a virtual program, and the training, there was some training that happened. We did find out later that we need more. And then we also had early on a focus group conducted by Dr. Porter and interested SHE participants. And it was very good and very exciting. It was the Black Women's Health Alliance staff, as well as the Philadelphia Health Department staff, and the SHE program participants. And it went very well. And I think the women were very excited about coming aboard. Okay, and so then program implementation and registration. So the registration was also a very awesome and exciting day. Again, due to COVID, the women came to the Black Women's Health Office. Everyone was masked, and we took temperatures and tried to keep everything sanitized, because at the time, as I say, COVID was still pretty rampant. And so we registered 15 women, 6 women completed, and we'll talk a little bit about how that number changed. The women came, had scheduled appointments to come, and they came in Ubers and Lyfts, and so we didn't have a whole lot of people in the office at one time. So with the clinicals, we did we had pre and post. We do pre and post surveys. So in addition to the women getting their clinicals done, whereas we did blood pressure, weight, height, waist circumference, in order to establish a BMI, we also did a baseline survey, which is, I forget the number of questions, but it's probably, it seemed like about 30 or 40 questions on there or more, but it gives us a good idea of where the women are at this time coming into the program. And then at the end, how did all the tools and the information that they learned, how was it affecting them? Okay, so program, during the 12-week period, well, 13 weeks in that the pre-week is when we do the clinicals. The women are presented with evidence-based material, in addition, an evidence-based curriculum, as well as e-learning, as we mentioned previously, where they actually have access to the curriculum online, as well as a hard copy. We mailed out hard copies every 4 weeks. So when the women came for their initial clinical, we gave them a binder, as well as the first 4 weeks, and then they received the additional 8 weeks in 4-week packets. So the Primetime Sister Circle Guide, complete guide to midlife health and wellness. And I believe that is referring to the, the resource book. Okay, and they also received that. And then 13, as I said, it was a 13-week program, 2-hour sessions. And we had trained and certified facilitators. Myself, I was a lead facilitator along with my co-facilitator. And we were augmented various weeks with a nutritionist who did good and basic nutrition education. Our women were taught, what important things about eating properly, getting rid of the junk food and how to read labels. It was just very good, very good. Psychologist, she also did stress management. And we talked about one of the sessions is you can manage your stress. And we also, in another session, the women were taught about stress management and developing a stress management plan. And then we also had a session on hypertension where we had a nurse come in and talk about hypertension and how to understand the numbers and when your blood pressure is
Boy. Okay. Barbara is freezing.
high, when you need to. Oh, no. Oh.
You're okay.
Okay, can you?
You're okay.
I'm okay. Should I continue? I'll continue. Okay. All right. And then we also had a fitness expert who is a trained fitness expert, master's level, and she reviewed the role of exercise and fitness that it plays in your overall health. Okay. And the women were very, very, I have to say, this particular cohort, the first cohort, were very, very attentive to the materials that were given. We could tell they read the materials every week. They asked questions. They did the homework. We could see that they weekly had good progress. Every week when they came on, the first thing we would talk about is, all right, so what did you do this week that enhanced your health? How were you working towards prioritizing your health? And they would share all kinds of things, how we've even had women who stopped smoking. We had women who changed their diet. One woman used to tell me that she would have Mountain Dew and chips all day long. And so every week we kind of, it's like, how are you making out with that? She's like, Miss Barb, I'm not doing Mountain Dew and chips anymore. I'm doing fruit and vegetables and things like that. So it made a difference. It made a great difference in the program. So cohort 1 was conducted from October 27th, 2021 and ended in January 27, 22. And so the participants were provided with laptops or tablets. And but the thing is, the challenge was that, there was some concern with using them. We used evidence-based materials, as we mentioned, and the e-learning. They had a hard copy, and the women really used the material. Okay, so some of the successes. Participants stated that they were happy to have a safe place to share with other women. I often, when they would come in, I said, okay, this is Las Vegas. What happens here stays here. I would say, and so we encourage the women to share and to express their concerns. And a lot of the women talked about how, they kind of had a lonely life. They didn't have too many friends. One told me she didn't have any friends. And she said this coming to Primetime Sister Circle allowed her to interact with other women, share, and in a safe place, as we mentioned. Participants, as we mentioned, were excited to receive the materials and the e-learning. Participants also stated that they learned from the expert and put healthy living tools in practice. And we could see that happening, and as well as with the outcomes. The women had lost weight. They were becoming more active. They talked about, walking more, going to the gym, and just overall making changes to improve their health. Okay, and some of the barriers and challenges included, as we mentioned, COVID-19. We did have at least one woman that I know of that developed COVID-19 and was hospitalized and wound up actually as a result dropping out of the program towards the end. So as we mentioned, required transition from face-to-face to virtual. So initially our program was face-to-face, but due to COVID, we had to do a virtual program. So there was some hesitancy in the enrollment, and also for those who did enroll, about stigma. And some did not, for example, did not want to turn on their cameras initially, that did not necessarily want to be identified as being in the program. But as the weeks went on, those who were consistent with the program, we all could see each other face to face, with the exception of one woman, and I'm just going to mention this real quick, is she did the entire 12 weeks on the phone. She could not navigate her tablet, and she did it on the phone the entire 12 weeks. And so kudos to her. As we mentioned, limited computer skills. Going forward, we have to implement more training, okay? Because that really caused a problem with retention in the program. Some of the women were just not skilled with using computers or tablets. Personal problems in the home. We had some of the ladies who maybe did not live in their own home and maybe shared a home with someone. And so therefore, or had no control kind of things that went on in household. So therefore, sometimes we had noise in the background, concerns with childcare, things like that. But we navigated around it. We just encourage people to turn off their computer and turn off their sound until they wanted to speak. We also came upon a situation where one of the women had a situation with domestic violence and reported to us that she was living in that type of a situation. What we then did is report that to the Philadelphia Health Department staff. They did an investigation and follow up and did get services for her. So we never know what's going to come up. And but we were appreciative that we were able to handle that. Other issues are health issues. And a lot of the women admitted the reason that they are enrolled in the program were because of obesity, diabetes, hypertension. And almost all of the women mentioned that they had depression and anxiety. And also initially with the program, it was difficult because we were virtual for the women to develop relationships. However, as those that were consistent, we were able to develop strong relationships as we have in the past with face-to-face. Sometimes work hours were a conflict, and we had a few women that actually had to drop out of the program because their work hours were in conflict. So that's just kind of a synopsis of how this cohort went. In spite of the challenges, I feel it was very successful. And we encourage women to take a moment for yourself and prioritize your health. And that's it. Okay.
Thank you, Barbara.
Mm-hmm.
Yes, all of that and more, right? And we have Dr. Porter, Dr. Gail Porter from the Gadsden Porter Health Improvement Center, who's really going to share some information on the effectiveness of the Primetime Sister Circle program. And we're excited about it. We are in the process for cohort 1. Some of the data is being evaluated, the report, and moving forward to also have that same thing occur for cohort 2. Let's see here. Maybe I'm getting good enough to share this well
so.
without any hiccups. Yes.
Well, while
Many of you know that that's a good thing for me, right?
I must share with you, I am very proud of you for being as skilled as you are, because I'm still having other people to help. I just want to say good afternoon and welcome all of you who have taken this time to be with us, and to give a special thanks, of course, to the Black Women's Health Alliance and to the Department of Public Health and to the SHE program. Next slide, please. One of the things that we value is the diversity of the women that are part of our country. It's the next one. Right, there you go. Because we know that Black women in midlife are diverse in terms of our interests, our skills, our challenges, our opportunities, our beliefs. But unfortunately, one of the things that we share is that we are dying at rates that are greater than any other group of women. And that applies as well to sisters living in Philadelphia. And that was why we started the Gaston and Porter Health Improvement Center, because we knew that if we could change the one Black woman in midlife, she would change her community, she changed her family, she changed her work site. And so it was started in 2002. Dr. Gaston, the co-founder, is a physician. I'm a clinical psychologist. And our primary program is the Primetime Sister Circle. And we're funded by grants from local and federal governments and private and public institutions. Next slide, please. And our funders have been extremely varied, from the Ford Foundation, AstraZeneca, the Departments of Health, and the Black Women's Health Alliance. We want to encourage any small nonprofit, get diverse funding. It makes a difference. Next slide, please. And we are in various states. We're in 8 states at this point and Washington, D.C. And of course, we were so pleased when we got the grant for Philadelphia from the Walmart Foundation, because it gave us a chance to reach out to Philadelphia. And as you can see, we've been in a number of sites here, from the African American Museum to Zion Baptist Church. So we are community-based. The women don't come to us, we go to them, and we go to places where they are. The program is entirely free to all participants. And in the virtual state, it's 10 to 15, community-based and culturally competent. So we focus on listening to our women, and our women told us, don't send me a perky 90-pound, 20-year-old to tell me how to move my body. And so we have, as part of our staff, always listened to what our sisters say. It addresses all levels of health literacy. We have women who have never graduated from high school, and we have women who are physicians who've been in the program. As I stated, it's evidence-based, and the focus is on prevention. Next slide, please. And the participants learn to look at health holistically, to reduce their risk factors for chronic illness, reduce their blood pressure, prioritize their health. And the sisters tell us that's the most important lesson they learn, that you first have to take care of you, then you can take care of everybody else. But if you're not taking care of yourself, you're not going to be able to take care of anybody else. Practice stress management, increase physical activity, improve nutrition. And they say to us, this is the first time anyone has given us permission to take care of ourselves first. As you've heard, we have these various resources that the women receive. We have facilitators, and all of our experts are midlife Black women. Next slide, please. When we did the focus group, the sisters were very clear about what they wanted. And they said, first of all, Dr. Porter, we don't want another focus group on HIV. We don't want another circle on HIV. We want a support group that talks to us about our issues as Black women in midlife. But there were things that came up that we thought were very important that had to do with specific information on HIV stressors, health issues, and information on developing and negotiating with healthcare teams, because they talked about how hard it is for them to do that. Next slide, please. So as part of changing the curriculum, we stressed in our stress chapter and prevention some of the negative stressors that they experience: employment, parenting, financial difficulties, family issues, substance use, health and physical, emotional issues, a lot of shame and guilt, education training, which they often didn't get, concern over COVID, and concern over the Delta variant. The next slide, please. But there were also health issues that became apparent. They have gynecological issues, increased risk of cervical cancer, heart disease, medicine effects, and drug interactions. Next slide, please. The participants receive all of these things for free that you've heard about, from monitors to stipends. Next slide, please. But we spent a lot of time helping them learn how to partner with their healthcare team, and also how to develop a team, that they didn't need just physicians and psychiatrists. They need cardiologists, they need a pharmacist, they need complementary folk. So all of this is part of what they got from us. Next slide, please. But remember, no matter how wonderful a program starts, it doesn't work. And so these are the findings from 1,300 women from studies that were funded by the Kaiser and Walmart Foundations. Next slide, please. And the women self-report, the red is pre, the post is yellow. Prior to the circle, most of the women were very uncomfortable talking about prioritizing their health. By the end, over almost 80% were very comfortable saying, I've got to take care of me first. The same in terms of their stress management, their nutrition, and we were really excited about the reduction in salt, because over 52% of the women were hypertensive, and their exercise changed a lot. The next slide, please. They love the circle. They learn knowledge and skills from it, and they love the curriculum. And one woman said to us, if I'd had this, maybe I could have graduated from high school. The next slide, please. We had an average of 6 to 8 pounds in terms of women losing weight. Over 68% lost weight. The next slide, please. But what we were really excited about was that, as I said, over 52% of the women came in with major issues related to high blood pressure. By the time the circle was over only 20% did not have their blood pressure in control. That's an astounding statistic. And for Philadelphia, next slide, please. We pulled out the information. And again, what we saw, the next slide, please, was that when it came to hypertension and high blood pressure, over 40% of the women had it. By the end, they had controlled it, almost cut it in half. The next slide, please. And again, we saw this wonderful weight loss. Over 50% of the women lost weight. Next slide, please. And we've been very blessed. We've received some wonderful awards for the program. Probably the one that excited us most was that we were invited to meet President Obama as one of 15 national social innovators. And yes, he is as smart and fine in person as he is on the screen. The next slide, please. So I want to end this the way that we end all of our talks, because this is not just for the women. That's for those of you who are taking care of and providing support to our sisters. And this is a poem by Becky Bertha, who is from Philadelphia. The last chapter in our book is called Reaching the North Star. And it says, There will come a day, it is not far off now, when you wake in the morning and know that you were meant to be happy and healthy, and that you wanted more than you want things or memories, any concrete place called home, all the strings of the past that fasten you, more than you want justice or pride, your old clay image of yourself, or the faint chance that all that has gone wrong may still change. It is you who hold the power to change. And whatever it is that holds you, whatever it is you think you cannot live without, the time has come to open your hands and let it go. Run, flee, disappear, break loose, take wing, fly by night, move like a meteor, be gone. If you fear it will never be possible, think of Harriet Tubman, who traveled alone the first time, who finally freed 300 people, but first had to free herself. There's a Harriet in all of us, and we must take the opportunity to finally free her. Thank you. God bless and keep you in health and wellness. And remember that you are a Harriet. And thank you, Brenda. You did a wonderful job.
Thank you, Dr. Porter, as usual. I think maybe you now understand why we were excited about back in 2011 establishing this partnership. And I mean, we had standing room only at the launch down at City Hall with Dr. Gaston and Porter, and there were women waiting to sign up, hundreds of women waiting to sign up. So having this opportunity to partner with the health department is just really an honor, and we are very excited about it. But guess who we got to listen to? We're listening to the voices of the ladies. We have Fatima here, Lawani, who's going to share with us how she thought, what she thought about the Primetime Sister Circle program. Fatima, I'm sorry. Fatima Lawani, I'm so sorry. Thank you.
Hi,
Hi, Fatima.
how are you?
I'm good. How are you? Thank you so much. You're so
Thank you for
beautiful.
having me.
Okay, it's on you,
you.
dear. You got it.
Okay. Hi,
Oh boy. You can talk, Fatima.
okay.
It's
It went
just
off.
I see.
But
Yes,
yeah,
you can share. We
yeah.
got folks here waiting to hear from you.
Okay. Okay. So I heard about the She program from my and honestly, I'm not an open person, and I'm always shy when it comes to talking. So anytime I go to my doctor, she always tries to like talk to me. Oh, Fatima, how are you? Are you like making friends? Are you talking to anybody? I keep saying no, no, no. But then she said, okay, there's this lady. She's a very nice lady. There's this program. It's called the She program. Would you like to join? And I was like, okay. I was a little skeptical from the beginning, but I remember the first section when I came on, I was just on it. I didn't know how to use the tablet, but the first time just being on the meeting, seeing how everybody was talking and just giggling, I was just looking at them and I got curious. I'm like, okay, I think I can do this. So the next section, I had to call her. I'm like, I'm on the meeting. I don't know how to do it. And I'm just sitting there. She said, okay, she walked me through it and I got to talk to everybody and it was amazing. And honestly, from that moment, I fell in love with the program. And for some reason, I just felt like I wanted to talk. And I just opened up. I shared my story, how I got here, how it happened. And it's just a blessing. I think it's very important that sometime when you get help or when you see some people that actually do want to help you, that you allow them to do what they can, because it really helps me in so many ways. It helps me in how I see myself now, how I approach the people that's living the same situation that I'm living with, and also just how I eat, just everything in general. Because honestly, my exercising, I used to be very terrible with exercise, and my diet was it was just a mess. But coming up here, talking to them, and just hearing, just kind of make me feel a little more, actually, a lot more comfortable. And for that, I appreciate it. And I'm thankful that I was able to be part of this. It was helpful. And I'm gonna miss you guys a lot.
Well, guess what? We're not far.
We're
We're
not
not
going
far.
anywhere.
We're not far at all.
We're
And
not
just
going
because,
anywhere.
yeah, we're not going anywhere. The interesting thing is there are some sister circles. Barbara was a facilitator for some of those 300 persons that I talked about who went through the circles. And she still has contact
Mhm,
with some of the women
mhm.
who went through the circles. So this is just a beginning, and it's a style of life. It can be a style of life and self-care. Thank you so much, Fatima, for sharing with us.
Thank
Well,
you.
I am now going to open the floor for any questions
I feel
or
so.
comments.
Oh,
Okay.
okay.
No, go right ahead.
Go ahead.
I feel so blessed, and I feel overwhelmed sometimes when she, especially Miss Washington, she calls me or just send a text, "Hey, Fatima." And after talking, I just look at my phone like, oh my God, they care. They called to check on me. Oh, it just makes me feel comfortable to
Oh,
talk about stuff, because sometimes you don't want to talk about it, but you don't know who you're telling and what that person might do to help you anyway. And that it's amazing. So
awesome.
thank you guys. Thank you.
You're very
You're
welcome.
welcome. You're
You're
welcome.
very, very welcome. Thank you so much, Community Health Training Alliance, for this opportunity to share our partnership and the team, the Philadelphia Department of Public Health SHE team, and the Gaston and Porter Health Improvement Center team, and the Black Women's Health Alliance team. This would not have been possible without everyone standing together through COVID, and leaning in and being flexible. It's not that it wasn't trying sometimes. Yes, our timeline, Alexandra, yes. Our timeline sometimes had to be pushed because we didn't know really what else to expect, but we were resilient. The participants were resilient, and we were dedicated to making sure that this happened. Look forward to cohort 2, and thanks again, Dr. Reeder.
Thank you all for sharing your time, experience, and expertise with our viewers. This was a very important conversation to have, and I'm very thankful that programs and organizations such as yours exist. In fact, we just had a webinar prior to yours speaking to this very issue, the need of services for Black women, because we talked about, just the need and maybe the lack of access, or some of the challenges, the barriers that Black women face to find services specifically for their HIV care. And Fatima, thank you for being transparent and sharing of your experiences and of how your services have been really helpful to you. So thank you for sharing that. So without further ado, we're going to look into the Q&A box to see if there's questions. Viewers, if you have questions for our guests, feel free to add your comments or any questions that you may have for them. Right now, we just have a comment that says, "Great presentation, team," from a Dr. Judith.
Great.
Yeah, but I'm very appreciative of this conversation, and perhaps maybe we can talk more about how we can work together. As I was sharing with you prior to this webinar, we kind of identified how as Black women are across the US of A, we are the highest impacted group who are impacted by HIV, but is lacking services specific to meet our needs. Or if there's services, they're not culturally sensitive. Or if there's programming, we're not invited to the table. And if we are invited to the table, no one's listening. And so it's like a double-edged sword. And so I'm really thankful that you guys exist. I wish there was more programs such as yours around to service the needs. And so again, I solicit those viewers. If you have questions, feel free to add your questions in the Q&A box. So before we, I guess, close out, let's start 15, are there any last words or any contact information you would like to share with the viewers of how to get in touch with you?
Yes, I can share the, okay, let's see if I did well now.
You did.
Now let's see if this is going to be a repeat. Okay, I'm going to share the contact information for, that's Gaston and Porter Health Improvement Center, Inc. And we can put that in the chat box. Barbara, can you put their number, or either Dr. Porter, put that in the chat box? And I'm going to also share with you the contact information for the Black Women's Health Alliance.
Mhm.
Our telephone number, as well as our email address and our website. We can put that in the chat as well.
And I guess besides just thanking you, Community Health Training, Dr. Rita, for the work that you do, but I really, really want to stress to all of our sisters and brothers, we are in a pandemic that preceded the COVID pandemic, because again, Black women are dying at rates that are greater than any other group, even greater than our sisters who are living on reservations. And the important thing to know is that most of these deaths are preventable. That if we manage our stress, if we change our diet, if we exercise, if we take seriously the idea that I believe we are temples of the divine and treat ourselves as such, then we can not only live in a healthy way, but we are role models to the rest of the family and the community and all of the other groups that are around us. So I have a plea that we are going to make a commitment to having our health as our number one priority, our emotional and physical health. And again, I thank all of the organizations that are working to try to make this happen. And certainly our sisters who are HIV positive, that you are taking steps to try to improve your health outcomes. I mean, you are a blessing to us and you are a role model to other people. So thank you again for what you're doing. And of course, a special thanks to my sisters at the Black Women's Health Alliance. You make a difference, not just in your community, but in the country.
Dr. Reeder, we look forward to further discussions and partnerships.
That's right.
Yes, ma'am. Yes,
Okay.
ma'am. We'll be
Okay.
in touch.
All right.
So
Thank
if
you.
there isn't any other questions from our audience, can you unshare your screen just for a moment?
Sure. Absolutely. There you go.
Awesome. And those, you can look at in the chat, the number was listed inside for your viewing as well. Again, thank you. We definitely will be in touch with Brenda and Dr. Gail. We're going to kind of talk about other kind of educational offerings in the form of a webinar or some types of trainings. I think it's needed and necessary. And so again, thank you. So without further ado, I will end this webinar. Thank you, visitors. Be sure to join us for week 3 next week. Check out our website and register for an awesome week of training. We have guest trainers all the way from South Carolina speaking down barriers who will be doing training on the importance of building community. Thank you again all for watching, and I will talk to you guys soon. Take care.
Bye-bye. Thank you.
Bye.